Welcome to Guardian Home Care, your trusted resource for keeping loved ones safe and cared for at home. Today, we're going to explore a medical condition that affects millions of people worldwide, but can often be prevented with the right knowledge. Decubitus ulcers, commonly known as bed sores or pressure ulcers. Acting pressure ulcers with hosting as universal nothas by your district. Understanding the skin and pressure damage. The human skin is a remarkable organ. Strong, flexible, and protective. It's composed of multiple layers, each with its own purpose. When pressure is applied to the same spot over time, especially over bony areas, it compresses blood vessels and limits oxygen flow. This starves the tissue, leading to cell death. This is how decubitus ulcers begin, not from the outside in, but from the inside out. It's like a bruise that worsens, eventually breaking through the skin. Why and where bed sores happen? Bed sores typically develop where the bone is close to the skin. The most common areas include the sacrum, lower back, heels and ankles, elbows, shoulder blades, the back of the head in people lying down for long periods per separate. Pressure is the main cause, but there are contributing factors that make some individuals more vulnerable. Third, risk factors you should know. These are the key risk factors that increase the chance of developing decubitus ulcers. Reduced mobility. Conditions like stroke, spinal injury, or post-surgical recovery. Poor nutrition, protein, vitamin, or calorie deficiencies weaken skin and slow healing. Chronic conditions, diabetes, vascular disease, or neurological disorders. Incontinence, moisture from urine or feces causes skin breakdown. Aging skin, thinner and more fragile. Mental status, dementia or sedation reduces the ability to feel or report pain. These factors often work together, making elderly people the most vulnerable. Third, the four medical stages of pressure ulcers. Stage 1, the skin is intact but red and doesn't turn white when pressed. It may feel warm, firm, or soft compared to surrounding tissue. At this stage, pressure relief and repositioning can completely reverse the damage. Stage 2, the skin has opened or formed a blister. It looks like a shallow crater. This is a warning sign. Care must be taken to clean, dress, and protect the area from further injury. Stage 3. In Stage 3, the wound has progressed through the skin into the subcutaneous layer. You may see yellowish dead tissue, and the area may smell or ooze fluid. Infection risk is high. Stage 4. Stage 4 is a medical emergency. The wound may be deep enough to expose bone, tendons, or joints. There's a high risk of infection spreading to the bloodstream, which can lead to sepsis or death. Recognizing infection early. Look for signs of infection such as redness or swelling spreading around the wound, foul odor or green-yellow drainage, increasing pain or warmth, fever or chills, confusion or fatigue in elderly patients. Seek medical attention immediately if you see any of these symptoms. 6. Medical treatment options. Treatments depend on the stage and severity of the ulcer. They may include cleaning the wound with saline or wound cleanser, debridement or removal of dead tissue, surgical or chemical, special dressings that keep the wound moist while protecting from bacteria, antibiotics for infections, vacuum-assisted wound closure, VAC therapy for stage 3 and 4 wounds, surgical repair using skin grafts or flaps in extreme cases. 7. Home-based prevention strategies. You can prevent pressure sores at home by creating the right care environment. Repositioning. Turn bedridden individuals every 2 hours. Use side-lying and semi-Fowler's positions to reduce pressure on the sacrum and heels. Pressure relieving surfaces. Use alternating pressure mattresses, foam or gel cushions, heel protectors and elbow pads. Skin inspection. Check vulnerable areas at least once per shift or daily. Early detection saves lives. Hygiene and moisture control. Keep the skin clean and dry. Use barrier creams to protect against moisture-related breakdown. 8. Nutritional needs and pressure ulcer prevention. Poor nutrition slows healing. A registered dietitian should guide the patient's meal plan. Increase protein, eggs, poultry, legumes. Get enough zinc and vitamin C for skin repair. Add calories. Healing wounds require extra energy. Consider nutritional supplements if the person has poor appetite. 9. Physiotherapy and occupational therapy. Physiotherapists help improve movement and circulation. even if only through passive exercises. Occupational therapists adapt furniture, beds, and bathrooms to make the environment safer and reduce pressure points. 10. The emotional impact of bed sores. Living with bed sores can cause depression, anxiety, and social withdrawal. Don't ignore the psychological toll. Offer emotional support, patience, and dignity. 11. Supporting caregivers. Caregiver burnout is real. Caring for someone with chronic wounds can be physically and emotionally draining. Remember to care for yourself too. Join support groups, take regular breaks, and ask for help when needed. 12. Legal and ethical care. Responsibility. In some countries, neglecting pressure ulcers can result in legal consequences. As a home caregiver, you have the ethical responsibility to monitor skin integrity. Follow medical advice and seek help when you are unsure or overwhelmed. Empowerment and hope. Bed sores can be devastating, but they're not inevitable. With the right care, environment, support, and education, your loved one can heal and live comfortably. Knowledge is power, and you're not alone on this journey. Thank you for watching Guardian Home Care. Like, comment, and subscribe to learn how to keep your loved ones safe, comfortable, and well cared for at home. We're here with you every step of the way.